Okay, I'm sure that the speakers before me have talked about the extent of the problem, but let me remind you, and the figures might vary based on the data that you're taking. But as per what I have, 1.1 billion people across the world need a pair of eyeglasses to see clearly. The number could vary, but the problem is huge, and we will all agree to that. And it's not something new. Eyeglasses are a 700-year-old technology. In fact, a few days back, I saw some pictures on Twitter of Bahadur Shah Zafar's reading glasses. All diamond-studded reading glasses, wonderful looking. So it's not something that's been new. It's been there in existence for centuries. But why is it that so many people still do not have a simple pair of eyeglasses? And especially when it can be foundational for the social and economic development. So how I look at what glasses do is not just help people see clearly, but in so many different ways, economically, quality of life, learning outcomes, road safety, can make unprecedented difference to their lives. Now, again, we have to put the problem into perspective. If we want people who are out of our sector to get interested, and why is that important, first of all? Why is it important that people out of the healthcare sector get involved in solving this issue? Because that's when more attention comes in, more awareness comes in, more resources come in, because then it stops just being the baby of health and eye care, but it starts being a baby of the livelihood and skilling ministries, the labor ministries, the road transport ministry, the education ministry. So what we need to do is that push uh, the need for glasses, refractive error, presbyopia, opticals out of it being a health issue. It starts as a health issue. It always be a health issue, but it needs to get wider acceptance amongst uh, different sectors. And that's where how we look at the problem is that we align it with the UN Sustainable Development Goals. So at least 5 of the UN SDGs are directly connected with a simple pair of eyeglasses. And when you speak that language, a lot more people get interested in this subject. So if you're talking about, C21, which is one of our programs, no poverty, decent work and economic growth, everyone who requires to earn their livelihood needs to see clearly, whether these are weavers, artisans, factory workers, people in the community doing agriculture, tea, coffee, plantation workers, they all require vision to be more productive, to earn their livelihoods, to lead a better life. Truckers, someone is asking about regulations, right? One of the most heavily regulated thing in India is licensing, right? Having a driving license. You need an eye test for getting your driving license. Commercial vehicle drivers need to renew their driving license every 3 years, right? So it is pretty heavily regulated. But, we've found over the last 6 years, screening more than 600,000 drivers, commercial drivers, we found that 60% plus of them plus need a pair of eyeglasses to see clearly and still are not wearing it, or wearing a power which is not updated. So what does that mean? It means that, regulation cannot solve all the problem. We need to create awareness. Regulation is important, no doubt, but we need to create awareness. We need to create the demand for glasses, and there are lots of other things as well. The social stigmas associated with wearing glasses. Whether you talk about children, you talk about women, I'll ask you a question. If, have you seen any woman while getting married wearing glasses? Even in, our backgrounds, which I would like to believe are more mid to high income backgrounds. I haven't been to a marriage where I've seen the bride wearing glasses. I've been to lots of marriages where I've seen grooms wearing glasses, but I've not seen brides wearing glasses. This needs to change. Why should there be in today's time a social stigma associated with wearing glasses? Similarly, coming back to the drivers, if you are a driver and if you're wearing glasses, you're considered to be a dangerous driver. It's actually paradoxical because it should be the other way around. It should be that you're more employable, you're more safe on the roads because you're wearing glasses, but they fear that they will lose their employment if they're wearing glasses. So, it needs to actually start from the scratch, creating awareness, creating demand for glasses, uh, meeting the social stigmas, and then regulation. Because just alone regulation is not going to solve the problem. And we need to push it outside our area of work, which is health, because then it gets more eyeballs, more resources. Similarly with education, you must have seen, you all are experts in RE, and you would know that how COVID has hit children, and how drastically the rates of RE in children have increased these 2 to 3 years of sedentary lifestyles and exposure to digital mediums for education. So, if we talk the language of others, then we get more acceptance, that if, whatever you want to do with education in the country, you'll not be able to solve the problem if children cannot see the blackboards clearly, or whatever highways our road ministry makes, whatever infrastructure they put into place, if the drivers can't see clearly, they will not be able to uh, prevent accidents. So they would be killing machines on the road, putting their lives and others' lives at risk. Similarly, any weaver, artisan, factory worker, anyone working in the field of IT will not be able to be their optimum self because they need vision to see clearly. We screened 100,000 weavers in Varanasi for, they make Banarsi silk saris just before COVID. And we found that about 70% of them needed glasses. More than 80% of them were first-time wearers of glasses. That means if we hadn't gone and provided these glasses to them, they would not have been able to ever get a pair, or maybe have a pair much later in their lives. So what does that mean? That means that if where there is so much of direct correlation between someone's work and vision, there is inertia or lack of awareness. And because these are daily wages, they're earning their income based on the meter of saris that they weave every day. But even then, they are sacrificing, and they get other health issues because all of this is done in low light conditions. They need to bend forward to do intricate work. So they get back problems, other lifestyle issues, other health issues as a result of lack of vision. So now is the time when people are talking about optometry, solving the problem of RE. Trust me, 10 years in this area, I have, I've first few years, any eye care conference, any ophthalmology conference I used to attend, I never used to see any reference to the field of optometry, field of RE, presbyopia. It was all about cataracts, glaucoma, diabetic retinopathy. These things are important, but this is the lowest hanging fruit, right? And the maximum people are affected by this. But, good to know that that's now changing. In fact, I was end of last month in Singapore for the IAPB conference. And, you'll be very happy to know that about 70 to 80% of the discussions were on RE. They were not on cataracts and diabetic retinopathy and glaucoma. People have realized that, this can be a gateway into more advanced eye care. Once you get person in glasses, and typically it could be even as simple as a pair of reading glasses, they get involved in the eye care journey, and that can lead to detection of cataracts, glaucomas, diabetic retinopathies, other surgical interventions. So two great things happened couple of years back, there was this resolution by the UN General Assembly which talked about eye health for all, and the World Health Assembly vote which said that we need to increase the coverage of cataracts, but also need to increase refractive error correction coverage rates by 40%. So that means if it's 10, then going to 50%. If it's 40%, then going to 80%. So refractive error coverage by 40%. I think one of the speakers previously also talked about. What this means is that the world is now paying attention to the work that we do, right? There's another thing coming next year. It's called the SPEC strategy. So SPEC strategy is led by the World Health Organization. A group of organizations have gotten together and the launch is scheduled next year. So when the SPEC strategy comes in, WHO is going to work with the governments in different countries to get it implemented. And it talks about all the things that you had questions about: improved access to spectacles, building capacity of personnel to provide those spectacles, improving education, which is awareness amongst the population of wearing glasses, reducing the cost of glasses, talking about low cost dispensing, the cost of spectacles. How could we have good quality, affordable spectacles at low cost? There would always be people who require high cost fashion eyewear. That will always be a big market. But there's so many people in our country that require a simple pair of glasses. For them, it's a utility product, not a fashion or a luxury product. And then how do we strengthen research and surveillance and get more data in terms of the impact that we're creating, the compliance of wearing glasses, the productivity increase, the change in quality of life as a result of glasses. So if you add these acronyms, SPECS, it becomes spectacles, right? So this strategy is almost on the verge of finalization, and next year there would be a big launch in different countries. So it's the right time to be involved in the work that we are doing. So, in 2018, we worked with the University of Belfast to do a randomized control trial in the tea gardens in Assam, and found out that the average increase in productivity as a result of eyeglasses can be anywhere between 22 to 32%. If you're above the age of 50, then it becomes as high as 32%, which was termed as the largest increase in productivity due to any health intervention ever recorded. Not just an eye care intervention, but any health intervention. So why am I sharing this with you? And this led to a large project at an end where we are going to screen 1 million people, 10 lakh people in the tea gardens in Assam, and weavers associated in those tea garden areas. But why I'm sharing this with you is that all of this evidence makes the subject go beyond eye health and gets more adopters. And when you get more adopters, you get more attention, you get more awareness, you get more resources. And as a result of more resources coming in, the scale increases. And, you might have studied in your economics class about the economies of scale. And when scale happens, then cost becomes lower. And, when the cost becomes lower, it affects everything. It affects cost of glasses, cost of dispensing, more personnel involved in it, because, more demand is created. Currently, if we go to low income or rural areas, we're pushing glasses. There, when at a tipping point that happens, like it happened with the mobile phones, etc. Why do we have 95% plus penetration of mobile phones in the country? Because when that tipping point happens, where more people wear glasses than who do not, then the people who do not wear start asking for eye screenings, start asking for glasses, and automatically the costs of the dispensing solutions go down. So we thought that, this is a good time as an organization to talk everything in a very focused language. So we thought about the India Clear Vision Mission or the Bharat Ujjwal Drishti Abhiyan. We said that everything that our organization does, we would do it under this banner so that people can get their eye exams and that people can get their eyeglasses as a result. So it's also important to know that which are the flagship initiatives of the government of India, because when we are talking, the other person, the other party needs to be interested. And the biggest healthcare provider in the country is the government. We cannot solve the problem of low cost dispensing solutions or having meet the need for eyeglasses without involving the government. Whether we like it or not, government is a vital part and should be a vital part of our plans. So if you talk about things like Atmanirbhar Bharat, Skill India, Make in India, Beti Bachao, Beti Padhao, Ministry of Road Transport, Mr. Gadkari is doing a lot of work on improving the standards of road safety in the country and road infrastructure. All of this is not possible without vision. You cannot have a digital India if you are not able to see your mobile phones or your computer screens. You're not able to have a skill India if you're not able to see your mobile phones, see your work that you're doing, the skilling work that you're doing. If we've talked about drivers, you talked about children. Make in India, one of the large parts of Make in India is the exports, that the country would want to do, and which are the largest exported items from the country. These are handicrafts, handlooms, tea, right? So if again people do not have clear vision, the Make in India and Atmanirbhar Bharat missions will not be successful. So we need to involve the government, and like we saw with the Swachh Bharat Abhiyan and the toilets, etc. Then everyone starts putting money. Corporates start putting money into these endeavors because they want to be aligned with the government strategy in the various areas that they're working. So, as per our estimate, and again, this could be debatable, but, what would not change is it's a very high figure that 60 crore people need glasses in our country. And, this involves just about $5.6 billion to solve this problem. Now, just to put it into perspective, I think Elon Musk bought Twitter for $44 billion, if I'm not mistaken. And we're just asking $5.6 billion to solve this problem across the country. And what it would lead to is at least a GDP growth of 5%. And I'm giving very, very pessimistic figures from more than a decade ago. Uh, in my opinion, to be very honest, it will be at least 10% GDP growth. What would that mean? So that would mean that, completely our economy is changed. Our country spirals into a completely different league of nations. If I am the head of the country, I would first invest in optometry. I would invest in glasses. I would invest in solving the problem of RE and presbyopia in the country, because that's going to be, a tremendous growth driver for economic development, but also at the same time be winning me the election again, right? So, and as the head of the country or head of a political party, why would I not want to win an election? And that's the reason why you see a lot of initiatives with good intention, but they also win election, like the Kanti Velugu initiative in Telangana a few years back. It happened just before the elections. It's happening again this year because elections are later this year or early next year in Telangana, right? So, some states have realized that this is actually just more than a health initiative. This is creating instant, measurable, tangible impact. And what it would really require is an army of optometrists, an army of colleges doing optometry education, eyeglass manufacturers, lens manufacturers, people who are doing screenings, not-for-profits coming into this space, corporates coming into this space. So it will completely explode the sector. And when that happens, automatically the costs go down. Like, I remember when we started using mobile phones in India, 16 rupees per minute was the uh, cost of the call. 16 rupees, we used to have these big phones, 16 rupees per minute. Now what's the cost? We don't even know what the cost is. It's almost free. Actually, with internet coming in, it's totally free. So, so to enable low cost dispensing solutions, we need to generate demand. So just a little bit, touching reference to our work, we've helped 6 million people with eyeglasses in India, and we annually provide more than 1 million glasses, and directly and through our partners screen more than 2.7 million people in India. And at the time of COVID, we touched more than 4 million people with COVID response activities. We are spread across India, and we work with lots of different kinds of partners. I think, this slide is important, not just to tell you about the extent of our work, but to tell you about the importance of partnerships. If you need to scale, if you need to make anything low cost, we need to have partnerships. Optometry institutes partnering with not-for-profits, for-profits, with optometry associations, with people working in rural areas, in urban areas, with retail store chains. All of them need to come together. That's when scale happens. That's when policy change happens, and that's when the costs become lower. So we've also, in Noida, have a warehouse, which is a completely SAP-enabled warehouse, and a training center where we ourselves do education. Currently, our education is limited to our staff. We also have, several optometrists in our team across the country, working in communities, schools, factories, transport hubs, beaver clusters, tea gardens, and so on and so forth, doing eye screenings and provide glasses. So all the training, internal training happens at a training center, and all the stock of eyeglasses get stored at our warehouse. We also have our lens lab, which is the first solar powered lens lab in the country. It completely operates on solar. It's an edging edging lab, and it completely operates on solar power. And we have optometrists here as well for quality checks, etc. So one of the initiatives that, apart from the warehousing and supply chain initiatives and the lens lab that we talked about, our goal, because we work with low income people, is to also reduce costs. So through all these initiatives, supply chain initiatives and technology, we reduce the costs. We do a digital data capture at our outreach sites, which reduces costs, increases the efficiency of the operation, ensures quick delivery of glasses, specifically prescription glasses. About 15 state governments across the country work with us for their prescription glass needs as part of the NPC BVI program. What we did last year, based on our experience of COVID and other factors around the world, we moved the supply chain of our glasses to India. So we started our Made in India, Made for the World range, and we said that, let's support the government of India, let's make in India, let's become Atmanirbhar. So we started manufacturing glasses in India for all our needs in India. And we would this year also start exporting glasses. What it did was that it tremendously reduced the cost of glasses, or enhance the quality tremendously at the same cost. Uh, so, uh, which I believe is extremely important if we need to touch the masses and if we need to scale. So we thought that, when we import some products, we are not in control of the designs, the shapes. Our people have their own needs. We have, in India is a combination of different cultures and different likes, dislikes. So we need to understand what our people require and make it at the lowest cost possible without compromising on the quality. So all of these are certified glasses, very good quality, but at the same time at the lowest cost possible, and keeping in mind the needs of our people. And if you're able to do that, and if you're able to cut the inventory time and make our production just in time with our needs, it reduces uh, back-end costs, it creates efficiencies, and those costs can go to the people. So this is one of the big moves in terms of low-cost dispensing, apart from using technology and warehousing and digital data capture at the outreach sites that we did. And so far the responses have been extremely good. So what were the issues that we were facing? There was inconsistent supply, especially with COVID coming in. All imports got hit, uncertified products, unpredictable quality. We did not have uh, bulk stock available. If you have to take 10,000 glasses of +3 readers, let's assume, you don't find it anywhere. So you need to buy a combination of powers, 6 powers or whatever, or 12 powers to get, a +3 reader. But we thought that, can we have, bulk SKUs of a single power available? How can we reduce freight costs, delays in delivery, and the unpredictable, if you see how rupees depreciated over the years, it was getting very difficult to maintain low cost with the dollar going up. So, all of this enabled us to find really low cost, high quality, affordable solutions for uh, the people of our country. And we want, all of these factors that are on your screen: durability, material, style, relationships with suppliers, made in India. We're meeting that. And also it just makes everyone so proud that we are now having glasses made locally to meet our local needs. So these are some of the features and benefits of our glasses, and taking in feedback from a lot of our partners, focusing on different powers and finishes and shapes, etc. In fact, the eyeglass that I'm wearing is also from that range. We call it the Day to Matter range. And we had really about 444 SKUs, which is again unheard of at a low price point for low income people's needs. So that every time we go to school, every time our partners go to schools or to a factory or to a village, we are not just offering glasses, but we are offering a variety of glasses for them to make a choice. Because whatever your income level, you need to have the dignity of choice, and you need to have the the authority to decide what you require. And this is really what we are trying to bring in through our glasses. And because it's not just important to have low cost dispensing solutions. It's important, but it is also equally important to have choice. It is also equally important to have compliance levels. A lot of times in many camps, glasses are given, but those quality is not there. People will not wear it. In fact, once they have a bad experience with glasses, they are scarred for life. They will not themselves wear it. They will tell their family members that, glasses are, they don't help solve their problem. So we need to give, at a low price point, good experience to people, and give them the choice, because people want style. However poor you may be, you want to look good. And in fact, if you talk about rural India, the social sectors are the social fabric of rural India is much more intermingled and intertwined than us living in urban areas. We live in our houses or apartments and largely are cut off from our neighbors. But when you're when you are living in a rural environment, you are more social, like we used to be probably 20 years back, right? So that still exists in rural areas, smaller towns. So when you are having more social connections, you're more conscious about what you wear and your lifestyle and your fashion habits. So we must not underestimate, because that's one of the reasons why so many people do not have a pair of glasses. So these are some of our values of our organization that we brought about in our range of eyeglasses. Uh, so we, people like to use this, and this is the last slide. People like to use the word impact unicorn, unicorns, right? So, what is a unicorn? A startup becomes a unicorn once they have $1 billion of revenue. So we also call ourselves an impact unicorn, where we feel that, we do not have $1 billion of revenue, but we have created more than $1 billion of economic impact in India through our work. And that's the power of clear vision and the power of 6 million pair of glasses worn by adults and children.